Hello and welcome to Good Life, the health show with me, Puja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, world is facing COVID-19 infection, which has created havoc in the entire world and has affected all aspects of human lives. Well, despite creating awareness and providing adequate information to the general public through various means, there are a large number of myths associated with the spread and treatment of COVID-19 infection in the society. Well, these myths are traveling from one person to the other through social media platforms. And so to discuss on this, we are being joined today by Dr. Satyaki Saikia, Consultant Internal Medicine, Excel Care Hospital. So not to waste any more time, I'll straight away move to him and talk more on the topic which we have taken today. Thank you so much, Doctor, for coming to Good Life, the health show. And in the entire episode, we are going to touch upon the important topic which is related to COVID-19. And I'm sure you must be answerable to all those viewers who will be calling us because our numbers are flashed on the television screens. And if you have any queries, please do join us and call us, and I'm sure Doctor will be probably give you all the answer. Now, Doctor, my first question to you would be for the topic which we have taken today. Why is there so much a variation in the presentation of COVID?
Yeah, hi Puja. Thanks for having me, and I think this is really important what we are doing today. The first question that you asked is something actually that I get asked a lot. And I think this is probably in the minds of a lot of people, patients, families, even doctors, because we have found that, we know a little bit about COVID now. We know that it is caused by a virus. What people are a little confused about is why is it that a disease can be asymptomatic in some people and cause the death of another person. Or it sometimes causes very mild symptoms in some people, and then some people land up in the ICU on a ventilator and they need so long to recover from the illness. So how is it that the same virus does such different things to different people? And I think the main reason this happens is because people need to realize that in COVID, we have two parts to the sickness, to the illness actually. The first part is the viral illness, which is very predictable. The virus gets in, it causes a mild viral syndrome, it causes some fever, some body aches, etc. And then the virus usually disappears around the 9th, 10th day of the illness. The virus actually leaves us, it dies and it goes away. But as the virus is in our system, in some people, it turns on what is like an immunological switch. And these people start developing what looks like an allergic or an immunological phenomena in reaction to the virus. So most of the pathology of COVID that we see is not what the virus is doing to us, but the manner in which our body responds to the virus. And because each person is different, the manner of responding to the virus is different in each person. So some people do not respond at all. Those people remain asymptomatic. Some people respond a little bit, they are the mild ones. Some people respond more than that, they are the moderate and more severe ones. And some people have a really exaggerated immune response, and they are the ones who go on to develop the really severe COVID symptoms. So this indicates that it is not just the virus that is causing the problem, but the manner in which we react to it.
All right, Doctor, so in that context, can we say that if we talk about the asymptomatic patients, so they are little and less contagious to the virus?
Actually, that is not true. What we have found is, as far as contagiousness goes, they are equally contagious, but because they actually harbor the virus for a shorter period of time, they might be contagious for a less period of time. So somebody who actually has COVID, if they are asymptomatic, they will harbor the virus in their body for a shorter period of time, maybe for about 5 days or 6 days. And somebody who has severe symptoms may harbor the virus in their body for a much longer period of time, maybe 10 or 12 days. So the duration that they're infective might change, but not the degree of infectivity. So most of the time, the highest infectious period is believed to be 2 days before the onset of symptoms till about the 5th day of symptoms. So it's this 1 week period. So actually they become infectious even before they know that they might have COVID. So it's about 2 days before they become symptomatic. And then about 5 days after they have developed symptoms. So this is the danger period. So it
Okay.
might be a day or two shorter for those asymptomatic people, and it might be a little longer for those who have severe symptoms.
All right, doctor. So now if we talk about the main causes of a shortness of a breath and fatigue, so what would be that?
The main cause for shortness of breath, now we know that COVID is a virus that actually affects the lungs. So the main cause for shortness of breath is the involvement of the lungs. However, COVID is not just a respiratory virus. COVID affects a number of other symptoms. It affects our blood, it can affect the heart, it can affect the liver. So all these other systems that are affected can actually cause shortness of breath, not just during COVID, but later on, even after the COVID virus has gone away from the body. So this is one of the most frequent problems that we hear about in the post-COVID period.
Okay.
People will come back and say that I'm still short of breath or I haven't gotten better. So most of these people probably have involvement of their lungs with COVID, what we call COVID pneumonitis, but that is not the only cause of shortness of breath. Some people have what we call deconditioning because they are in the hospital or they are in isolation, they have stopped walking, and over a period of time, the body is not able to exercise as it did before. So the moment they start exerting themselves, they start getting short of breath. Some people have thicker blood. COVID is known to cause blood that becomes thick. In fact, it's known to cause blood clots. So some people who have heart disease might have shortness of breath because this thicker blood is now affecting their heart. COVID by itself can actually cause myocarditis, which is an inflammation of the heart muscle. That can lead to shortness of breath. And last but not the least, a lot of people are developing shortness of breath, not because they have an organic problem from COVID, but because they're extremely anxious that they may have a severe problem with COVID. So anxiety, we have found, has been one of the leading causes of shortness of breath in the pre or during COVID or in the post-COVID period.
Post-COVID. All right, doctor, we'll come to more questions, but we have a caller waiting for us, so let's take his or her question at first. Hello?
হয় নমস্কাৰ মই ডিজিটেল হলো সামনাই পৰা এতিয়াতো কোভিড সিচুৱেচনটো কমিছে মানে এতিয়া স্যানিটাইজাৰ আৰু মাস্কটো কিমান দিনলৈ ইউজ কৰি থাকিব পাৰে এটো জানিব বিচাৰিছিলো মই
হয় কোভিড সিচুৱেচনটো কমা নাই আপোনালোকে যদি ভাবা আৰম্ভ কৰে যে কোভিড সিচুৱেচনটো কমিছে আৰু আমি স্যানিটাইজাৰ আৰু মাস্ক ইউজ কৰাটো বন্ধ কৰিব পাৰো তেতিয়া কোভিড সিচুৱেচনটো আকৌ বাঢ়ি যাব কোভিড সিচুৱেচন কমাৰ এটাই কাৰণ আপোনালোকে স্যানিটাইজাৰ আৰু মাস্কখন ইউজ কৰি আছে আৰু জোৰকে পেলাই চৰকাৰে আমাক বাহিৰলৈ ওলাই যাবলৈ দিয়া নাই আমি যেতিয়া এই কথাখিনি যেতিয়া আমি ফলো কৰা নাছিলো যেতিয়া আমি মাস্ক পিন্ধা নাছিলো আমি যেতিয়া কোভিড আপোনাৰ স্যানিটাইজাৰ ইউজ কৰা নাছিলো বাহিৰত ওলাই গৈছিলো আৰু যিখিনি প্ৰিকশনৰ কথা কৈছিলে কৰা নাছিলো কোভিড হেতু কাৰণে বাঢ়িছিল সো আমি যদি মনতে ভাবু যে এতিয়া কোভিড ভাল হৈ গল আমি মাস্কখন খুলি পেলাব পাৰো বা স্যানিটাইজাৰ নকৰিলেও হ'ব কোভিড আকৌ ঘূৰি আহিব আকৌ বাঢ়িব সো এইটো কথা হয় যে কোভিড সদ্যহাতে কিছু কমি আহিছে কোভিডৰ যেটো প্ৰকোপ আছিল সেই নম্বৰবিলাক কমি আহিছে কিন্তু তাৰ মানে এইটো নহয় যে আমি মাস্ক বা স্যানিটাইজাৰ ইউজ কৰাটো বন্ধ কৰি দিব পাৰো এতিয়াও ইউজ কৰি থাকিব লাগিব আৰু আমি সেইখিনি যদি আমি মানি চলিব পাৰো আমি কোভিডক তেতিয়া হলে কমাই বা পৰাস্ত কৰি ৰাখিব পাৰিম
All right, thank you so much for calling at this moment. So, doctor, now coming to a question which have been asked by many who have recovered from COVID-19 is that how soon or later can they do a vigorous exercise, which is the need of the hour absolutely at this point in time. So, what do you have to say on that?
Okay, so what happens in COVID, just like I mentioned a little while back, a number of systems get affected. The primary is the lungs, but then we also get some involvement of the heart and we get involvement of blood. And we have noticed that a few people, some unfortunate ones actually, we have noticed that people who have started indulging in very vigorous activity has developed complications related to COVID to the point of developing heart failure or even developing a heart attack. We generally recommend not to engage in severe or high levels of activity for at least 3 months after recovering from COVID.
All right.
At the same
Doctor,
time, we
we'll come
also
to
tell
that,
people that
of
you
course.
should not...
Okay, Doctor, we'll come to that query, but we have a caller waiting for us, so let's take the call. Hello?
okay ma'am
Hello?
ma'am
Yes, আমি শুনি আছো আপোনাৰ প্ৰশ্নটো কৰিব
স্যার আমার একটা লড়া আছিল হি মানে কনজেনিটাল হার্ট ডিজিজ আছিল
তাৰ লেফ্ট হাৰ্টটো চেপ্টাম আছিল আমি 5 বছৰত তাৰ এটা মানে বেলুনিং কৰিলোঁ নাৰায়ণ নিদালত ডক্টৰ দেৱী চেত্ৰীয়ে কৰিছিল কিন্তু এতিয়া তাক আমি তাৰ 22 বছৰ হ'ল তাক এতিয়া আমি কোভিড ভেকচিন দিব পাৰিম নেকি ছাৰ এইটো অলপ জানিব বিচাৰিছোঁ
হয় আপোনালোকে কোভিড ভেকচিন দিব পাৰিব আৰু মই ভাবোঁ তাক কোভিড ভেকচিন দিয়াটো খুব আৱশ্যক কাৰণ তাৰ যিহেতু অলৰেডি এটা আণ্ডাৰলাইং কনজেনিটেল হাৰ্ট ডিজিজ আছে যিটো কাৰেক্ট কৰা হৈছে কিন্তু ইনফেকশ্যন এটা যদি হয় তাৰ প্ৰভাৱটো তাৰ ওপৰত বেছিকৈ পৰিব পাৰে সেইকাৰণে যিহেতু তাৰ কোমৰ্বিডিটি আছে অলপ হাই ৰিস্ক ল'ৰাজন তেখেতক প্ৰটেক্ট কৰাটো আৰু বেছি আৱশ্যক সেইকাৰণে ডেফিনেটলি তেখেতক কোভিডৰ ভেকচিনটো দিব
All right. Thank you so much for asking that question. Doctor, that was indeed a very important query, which at least comes up because the person who is already suffering from some kind of ailment, do that person can take a COVID vaccine or not? So on that note, what would you like to tell our viewers?
So the most important thing is that most people who have any kind of chronic illnesses are supposed to take the COVID vaccine. The whole point of the COVID vaccine is that these people who have comorbidities, meaning if they have heart disease, if they have diabetes, if they have any kind of chronic medical problem. A lot of people with asthma ask me, am I able to take it? Or people with COPD, chronic obstructive pulmonary disease, they ask me, can I take the vaccine? It's absolutely important for them to actually take it, just like they take the pneumococcal vaccine or the flu shot.
Okay.
The reason for that is once they get COVID, they are very highly likely to get the very severe form of COVID. That's the reason we need to specially protect these people. The only people where we say you need to talk to a doctor before taking the COVID vaccine are those people who are on immunosuppressive medications. So anything that really suppresses the immune system. So if it's a transplant patient or any kind of immune disorder that can suppress the immune system, say the patient is HIV positive. So these kind of people, they need to consult a physician before they take the vaccine, whether they're eligible or not. Even they, I would not say are not eligible, but they need to do it under the guidance of a physician. But all other people who mostly have chronic medical problems are actually eligible for the COVID vaccine.
All right, that was indeed a very important message to those viewers who are really confused now, and I'm sure their confusion must be clear on some part of note. But Doctor, we'll have to slip into a short break, but we'll come back soon and we'll have a discussion on this fruitful topic. Welcome back. You are still watching A Good Life, the health show with me, Puja, and we are having a fruitful discussion on the important issues that is being related to COVID-19. So, Doctor, coming back to you again, we were talking on the vigorous exercise if a person has recovered from COVID-19. So, you were suggesting something. Please go on.
Yeah. So what I was saying is that we generally tell people that they should do mild physical activity and slowly grade it up as their body tolerates it, because it is important for them to do a lot of lung exercises, especially if they had involvement of the lung. But some people tend to go overboard, or if they used to do gyms before, or if they used to bike or these kind of vigorous physical activities, those should probably be limited for a period of 3 to 4 months before diving back into these kind of activities, especially if they have associated comorbid conditions, if they have heart disease, or if they have pre-existing conditions, where these conditions might suddenly take a turn for the worse if they engage in too much activity.
All right. Now, there is a lot of questions which surface in everybody's mind. Now, talking about the mask which is being used prolonged with days, and we have to use it for hours and hours. If I talk about myself, I have to use it for hours and hours. So, in that condition, does it cause any health problems? Do I have to worry about any health problems while wearing mask for a long time?
Wearing a mask, this is also another question that we face quite frequently, because some people who are at work for long periods of time, they sometimes have to wear a mask for 12, 13 hours a day. It's happening with our healthcare professionals also, the sisters who work in the COVID ward. So by itself, the mask does not cause healthcare issues as such, but it can cause certain symptoms, especially if you do exertional activity wearing a mask. So first thing we generally say is that if you're doing anything that requires excessive exertion, you probably should not be wearing a mask. So a person should not be jogging wearing a mask. A person should not exercise or do a strenuous physical activity wearing a mask. Masks can cause a little bit of dizziness, it can cause headache, it can cause a little shortness of breath, especially if you have pre-existing lung disease. For some people who have immunosuppressive states, say for example a patient who is diabetic, who's on large doses of steroids, and who's wearing a mask constantly, because the mask traps a lot of moisture in the area of the face or inside the sinuses, it has been linked in some of these reports to the possibility of getting fungal infections in these areas. Now, the moment I say that, I have to again tell you that please do not think that wearing the mask is going to cause this whole black fungus outbreak. It does not happen in most people. But yes, in those people who are really susceptible, keeping a mask on for long periods of time might trap moisture and increase the chances of that. Okay. What can people do when they need to wear a mask for long periods of time? I would suggest that after about a couple of hours or so, every couple of hours, they can find an open window, open the mask, take some deep breaths of fresh air, not in front of people, not in a closed room, but find a place somewhere where they can go out and open the mask and take a break.
Okay, that's a good suggestion, and of course I will also follow that at the point. And all right, doctor, we have a caller waiting for us, so let's take the call. Hello.
Hello, আপোনালোকৰ অনুষ্ঠানটো মই চাই আছো কোভিড নেগেটিভ হোৱাৰ কিমান দিন পাছত আমি সিটি স্কেন এখন কৰিব লগা হয় লাঙৰ কাৰণে, আৰু ডক্টৰে অলপ আগতে কৈছিলে মায়োকাৰ্ডিয়াচিছ বেমাৰটোৰ কথা। সেই অসুখটো যদি শিশুসকলৰ থাকে, কিছুমান শিশুৰ যে থাকে, তেওঁলোকক মানে আকৌ বেলেগকে সাৱধানতা ল'ব লগা হয় নেকি সেই অসুখটো থাকিলে, যদি সেই অসুখটো অলৰেডি ভাল হৈছে এজন শিশু বা এগৰাকী শিশুৰ ক্ষেত্ৰত?
Okay, so আপোনাৰ প্ৰশ্নটোৰ দুটা ভাগ আছে, so মই দুইটা ভাগ অন্যকে পেলাই হেৰি কৰোঁ, উত্তৰ দিওঁ। প্ৰথম, সব পেশেণ্ট যাৰ কোভিড হৈছে তেওঁলোকক চিটি স্কেন এখন নালাগে। আমি চিটি স্কেন কৰা উদ্দেশ্য এটাই যে আমি কোভিডৰ লাঙত যিটো ইনভলভমেণ্ট হয়, সেই ইনভলভমেণ্টটো কিমান সিভিয়াৰ হৈছে সেইটো গম পাবলৈ আমি চিটি স্কেন এখন কৰোঁ। যদি আপোনাৰ একো সিম্পটম নাই, যদি আপোনাৰ অক্সিজেন লেভেল কেতিয়াও কমি যোৱা নাই, আপোনাৰ হয়তো লাঙত যদি ইনভলভমেণ্ট আছেও সেইটোৰ কোনো ট্ৰিটমেণ্ট দৰকাৰ নাই, সেই অৱস্থাত আপোনাক চিটি স্কেন এখনৰ দৰকাৰ নাই। যদি আপোনাৰ লাং ইনভলভমেণ্ট হৈছে, খুব বেছি কাহ হৈছে বা অক্সিজেন লেভেলটো কমি আহিছিল কোনোবা এটা সময়ত, তেতিয়াহ'লে এখন চিটি স্কেন কৰা আমি ভাবোঁ উপযোগী, কাৰণ আমি তাৰ পৰা এটা চিটি চিভিয়াৰিটি স্ক'ৰ এটা গম পাওঁ, CTSS বুলি যিটো কয়, আৰু সেইটো দি আমি গ্ৰেড কৰিব পাৰোঁ যে আপোনাৰ কোভিড কিমান চিভিয়াৰলি হৈছিল। এই স্কেনখন কোভিড হোৱাৰ পৰা এসপ্তাহ আগতে কেতিয়াও নকৰিব, কাৰণ আপুনি যদি বেছি সোনকালে চিটি স্কেন এখন কৰে তেতিয়াহ'লে আমি কোভিডটো আণ্ডাৰ এষ্টিমেট কৰা হয়। তাৰপিছত কোভিডৰ বেমাৰটো প্ৰগ্ৰেছ কৰি গৈ থাকিব পাৰে, পিছত আকৌ এখন চিটি স্কেন লগা হ'ব পাৰে, আপুনি আননেচেচাৰিলি আৰু অলপ ৰেডিয়েশ্যন পোৱাৰ নিচিনা হ'ব। চ' দৰকাৰ নহ'লে এসপ্তাহৰ আগতে ডেফিনেটলি চিটি স্কেন এখন নকৰিব। যদি আপোনাৰ হস্পিটেলত থাকোঁতে চিটি স্কেন এখন নহ'ল কিন্তু আপোনাৰ অক্সিজেনৰ দৰকাৰ হৈছিলে, তেতিয়াহ'লে হস্পিটেলৰ পৰা ওলোৱাৰ পাছতো এখন চিটি স্কেন কৰি চাব পাৰে, কাৰণ চিটি চিভিয়াৰিটি স্ক'ৰটো সেইখনতো গম পায়। চিটিত যিবিলাক চেঞ্জেছ হয় কোভিডত, সেইবিলাক ৰিকাভাৰ কৰিবৰ কাৰণে বহুত সপ্তাহ লাগে, সেইকাৰণে ইমিডিয়েটলি লগে লগে চিটি স্কেনখন নৰ্মেল হৈ নাযায়। চ' চিটি স্কেন কৰা উদ্দেশ্যটো সেইটো, চবকে কিন্তু এখন চিটি স্কেন কৰা দৰকাৰ নাই। মায়োকাৰ্ডাইটিছৰ যিটো প্ৰশ্ন সুধিলে, মায়োকাৰ্ডাইটিছ বহুত মানুহৰ হ'ব পাৰে কোভিড হওঁতে, বেছিভাগ মানুহৰ মায়োকাৰ্ডাইটিছ হ'লেও সেইটোৰ ডিফাৰেণ্ট বা ছেপাৰেট ট্ৰিটমেণ্ট একো দৰকাৰ নাই। ইট ইজ জাষ্ট পাৰ্ট অফ দ্য ইলনেছ, পাৰ্ট অফ দ্য ভাইৰেল ইনফেকশ্যন, এণ্ড ইট গেটছ বেটাৰ অন ইটছ অ'ন। কেতিয়াবা দেখা পাব যে হাৰ্ট ৰেটটো অলপ বেছি ফাষ্ট হৈ যায়, কেতিয়াবা অলপ শ্ল' হৈ যায়, এনেকুৱা ধৰণৰ কিছুমান চিমটমছ দেখা যায় মায়োকাৰ্ডাইটিছ হ'লে। আগতে মায়োকাৰ্ডাইটিছ হোৱা পেচেণ্ট এজনৰ কোভিড হ'লে নতুনকৈ বেছিকৈ মায়োকাৰ্ডাইটিছ হ'ব যে তেনেকুৱা কোনো কথা নাই, তেনেকুৱা একো নহ'বও পাৰে। কিন্তু যদি মায়োকাৰ্ডাইটিছৰ আগৰ হিষ্ট্ৰী এটা আছে আৰু তেনেকুৱা এজন শিশুৰ যদি কোভিড হয়, কোনোবা এজন ভাল এক্সপিৰিয়েঞ্চ ডাক্তৰৰ লগত পৰামৰ্শ লোৱাটো ভাল, কাৰণ ট্ৰপনিন বুলি এটা টেষ্ট আছে যিটোত মাসল ড্যামেজ দেখা পোৱা যায় আমি সেই ট্ৰপনিন টেষ্টটো কৰিলে মায়োকাৰ্ডিটিছ হৈছে নেকি সেইটো গম পাব পাৰো
All right. Thank you so much for calling, and I'm sure the question which you have asked must be answered and must be fruitful with you, and of course, your confusion must be clear at this moment. All right, doctor. Now let's talk about some of the myths which is circulating everywhere. People are really confused. They are believing with some myths, which is of course going from mouth to mouth. Discussions are going on. Now, if we talk about the myths, suppose the antibiotics can cure COVID-19. COVID-19 only affects the older people. There are a lot of myths which is circulating. So do you also get those kind of queries sometimes in your clinic? So what do you have to say?
Absolutely. I think we get more questions about the myths than about the disease itself. I think the myths are probably, and they're propagating on social media, like anything, like an epidemic. So the two things that you mentioned about antibiotics preventing COVID, we do use antibiotics. A couple of antibiotics are part of the COVID protocol. And right in the beginning, when the first COVID wave came, there was two medicines, azithromycin and doxycycline, that we thought might have a role against COVID, because these two antibiotics have been shown to have some antiviral properties. However, over the last couple of years, as we have been treating COVID, we have found that specifically when we talk about treatment and as we have treated these people, we have not seen any appreciable difference in people who have been treated with azithromycin and doxycycline or have not been treated with it. So even though theoretically there is some antiviral activity, we have not seen that translate in the real world scenario where it makes a clinical difference when these people are treated with these antibiotics.
All
so
right,
I would
doctor,
not
we'll
suggest
come to
that these
more myths
people
and
just go out and buy a bunch of antibiotics and start taking them.
All right, doctor, I need to stop you in
Sure.
between. I will come to that, but we have a caller, so let's take the call. Hello? Hello?
Hello.
Hello?
Hello. सुनाई दे रहा है?
Yeah, please ask your question. We are listening to you.
सर ये अगर वैक्सीन लेने के बाद कितना दिन तक सर वो शरीर में दर्द रहता है सर?
I didn't hear him very clearly.
All right,
I heard something about
he
a
was
vaccine,
asking that
but I didn't
after
hear him
taking
very clearly.
vaccine, how long will the pain be there?
The pain from the vaccine or the pain, the body ache and the fever?
Yeah,
Is that what he's referring
basically
to?
the after effects of taking vaccine.
Okay. So generally, once you get the vaccine, there can be fever or headache after about 24 hours, and it generally clears away in about 2 days. So it should not stay for longer than 2 days. It is treated with simple paracetamol tablets, and it should simply get better after that. We have had a few people in whom, after taking the vaccine, they got exposed to COVID around the same time. And the symptoms kind of evolved, and in about 5 days, they started testing COVID positive. So if the symptoms stay for longer than 48 hours, and there is fever, and there is body pain, then it might not be the vaccine, it might be something else, it might be the disease itself. Then it is time to go in and get tested.
All right, thank you so much, Doctor. Doctor, we are really short of time, so could you please just put some light on the myths being circulated on COVID-19?
Sure. So the other thing that you were mentioning about older people being affected more often. So that is absolutely not the case. We have found that younger and older people both can be affected. We are more worried about older people because they have more comorbidities. They could have more serious illness. However, we are noticing that even young people can go on to develop severe COVID-19. Like I mentioned in the first part of the show, that a lot of it has to do with your immune system. So sometimes a very strong immune system in a younger person can actually have a deleterious effect in the progression of the disease, because younger people can also develop serious and significant COVID-19, and older people might also simply have mild disease.
All right. Thank you so much, Doctor, for sharing those wonderful thoughts at this point in time. I'm sure the viewers who have watched our show must be benefited with the answer just a doctor gave. And with this, we have come to the end of the show. We hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing more on COVID-related issues. So if you have any queries, do join us next Saturday at 3:30 p.m. live. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.